Hello my fellow smug ones, I hope you're all okay. Well, after Boris's COVID vaccine rollout announcement, I thought I'd answer a few frequently asked questions. I'll then talk about the rollout as well and say which hospitals are getting it first. So, let's begin. Okay, as you probably know, there are three different types of coronavirus vaccine at the moment. There's our own Oxford AstraZeneca vaccine, the Moderna vaccine, and Pfizer, not Pfizer, they spell it with a silent P. Like my mate Rick, I'm pretty sure he spells his name with a silent P. But anyway, there's Pfizer's BioNTech vaccine. So, let's begin with the frequently asked questions. These questions are taken from the Sun newspaper. How can we be sure the vaccine is safe with such a short testing period? And yes, quite a lot of people will be concerned about this. I've noticed through my comments on my other videos, there are quite a lot of people concerned about this. It says the vaccine has passed through all regulatory processes and clinical trials, but has been treated as a priority, which is very important, obviously, with the coronavirus going about. And yes, I can understand people being a bit afraid, but at the end of the day, this vaccine is to help us. The government aren't going to approve something which could kill loads of people. Will people who have already had COVID be vaccinated? People will be vaccinated whether or not they've had COVID. And that is very important because the coronavirus strand may have changed from the first and the second wave. So if we vaccinate them, then hopefully that will get rid of both strands. Are people protected after the first dose of the vaccine? The Pfizer vaccine requires 2 doses to be fully effective. The doses are given 21 days apart and are effective 7 days later. And I guess that second one is just a bit of a booster for the first. Is it compulsory to have the vaccine? No. People in the UK are not being told they must have the vaccine, because obviously our government isn't like other governments around the world who quite often dictate to their citizens. But health officials strongly advise those offered to take it. And hopefully, obviously, when more people take it, we'll hopefully be able to come away from these draconian measures like the masks and stuff. How long will immunity last once vaccinated? Scientists don't know the exact answer at the moment. Trial volunteers will be tested every few months. But as soon as we have that answer, we can then obviously plan for things a lot better. Is it safe for pregnant women and their babies to take the vaccine? Well, I can understand why you'd want to, but with something so new, the government, I don't think, or anyone would want to take the risk of possibly causing permanent damage to a baby or an unborn baby. Women are advised not to have COVID vaccine during pregnancy or if they're planning to get pregnant within the next 3 months. And that's obviously for the reason I said. Could there be a delay having the second vaccination due to low stock or supply problems? And that's obviously quite a concern because you're meant to have them 21 days apart. So if there isn't any, then it will probably become ineffective. It says the first batch of 800,000 will be used on 400,000 people. So they're saving those and not just going straight ahead and treating like, say, 7,000 and saving one back. So they've obviously already thought that. How have they, meaning the vaccine, been developed so quickly? Vaccines do normally take years to get developed and approved. In the case of the coronavirus vaccines, the same steps have been taken as for any other vaccine, including safe testing on humans in clinical trials. But this time, the process has been done in the shortest possible time without bypassing any of the usual stages. So no stages are bypassed. It's exactly the same as any other vaccine. They've just done it quicker, which is awesome. Okay, and do they work? There are lots of vaccines in development, but 3, the Pfizer, Moderna and Oxford AstraZeneca, have shown that they can prevent people getting the disease and are up to 95% effective. Having several COVID-19 vaccines helps increase the number of doses available and will hopefully get us through this a lot quicker. Okay, what about possible side effects? No vaccine is entirely without possible side effects. Even paracetamol can occasionally cause them. But the results from the clinical trials show so far that these side effects are unlikely to be serious. Dr. Rain, whoever he or she is, says side effects that come from a vaccine might be a sore arm or a mild temperature. And the good news about the vaccine that we're looking at is that it seems no different from any other vaccine. Okay, so how does the COVID vaccine work? That's a good question. It has 4 stages. Stage number 1, scientists take part of the virus's genetic code that tells cells what to build and coat it in a lipid so it can enter the body cells. Stage number 2, the vaccine must be stored and transported at -70 degrees Celsius before it's being injected into the patient. Stage number 3, the virus enters the cells and tells them to produce the coronavirus spike protein. Immune system produces antibodies to then destroy the infected cells. Stage number 4, the final stage, if the patient encounters coronavirus, their antibodies and T cells are triggered to fight the virus and kick its bum. Okay, let's talk about the rollout then. So it says vaccine doses will arrive in the UK within hours, and the first jab, the first injection, will be given on Monday. So that's less than a week away. That's awesome. We're finally starting to turn the tables on this wretched, horrible disease, and hopefully we'll soon be able to move on with our lives in good time. The COVID vaccine will arrive in the UK in hours, not days, according to England's Deputy Chief Medical Officer. Jonathan Van-Tam confirmed Pfizer jab will arrive on British soil very shortly after it was approved for use yesterday. And we were the first country in the whole world to approve this Pfizer jab. And Brexit obviously helped with that because we didn't need to go through all the approval stages of the EU. But that's another topic for another video. I'm not going to get onto Brexit, so don't worry. Professor Van-Tam told the BBC, now there is a technical issue relating to the Pfizer vaccine we currently expect to receive very, very shortly in the UK. And I do mean hours, not days. The technical issue he is talking about is the fact that it must be stored at -70 degrees Celsius. And once it comes out to defrost, it must be stored at 2 to 8 degrees, but only for 5 days. In total, 32 NHS trusts are standing by to roll out the Pfizer COVID vaccine from next week as of Monday. They have been chosen because they have super cold freezers and are able to store vaccines at -70 degrees. The trusts will act as hubs, which will then offer jabs to people in their area, in order of priority, as well as coordinating distribution. A London hospital is expected to be the first to give out the COVID-19 vaccine as of 7 a.m. Monday morning. So let's have a look at these hospitals. Okay, so if my editing skills were as awesome as Weeboof are, you should see a list of 53 hospitals. Just pause the list and you hope to see your own. I shall do a brilliant pose while you pause. But it doesn't say if the list is in order that it will get. It has the numbers of 1 to 53, but it doesn't say if it's that hospital's getting it first, then that one. It's just the first 53. Okay, this is the COVID vaccine rollout plan. As you can see at the moment, it has 9 phases or stages. Stage number 1, residents in a care home for older adults and their carers. Stage number 2, all those of 80 years old or over, frontline, and also for frontline and health social care workers. Stage number 3 is for all those over 75 years. Stage number 4, all those over 70 years and over, clinically extremely vulnerable individuals. Stage number 5 is all those over 65 years and over. Stage number 6, all individuals aged 16 to 64 years with underlying health conditions which put them at risk as a serious disease or mortality. Stage number 7 is all those of 60 years and over. Stage number 8 is all those at 55 years and over. Stage number 9 is all those at 50 years or over. And stage number 10 is going to be for everyone else. Although those first 9 stages, especially the first few, account for 99% of the people at risk. So hopefully, like I say, we should be getting back to normality once this has all been completed. Okay, how many millions of doses has the UK ordered? As you can see, it says here we've got 350 million doses on order. Now, at the moment, the UK has between 65 and 69 million people. So 350 million is more than enough. So let's see how this breaks down. 100 million is our very own Oxford AstraZeneca. 60 million is Valneva. Another 60 million is Novavax. Another 60 million is GlaxoSmithKline. I hope I said that right. Another 40 million is this, what we're now talking about, the Pfizer BioNTech. 30 million is Janssen, and 5 million is Moderna. The Sun has also conducted a poll of readers, and it says, would you be happy to take the vaccine next week? As you can see, a massive 60.5% of people said yes as soon as possible, including me. I put that. So that must mean it's safe, because trust me, I wouldn't take it otherwise. 19.9% of people have said, no, I'd rather wait a while, which is fine. I can understand them being cautious. Hopefully when the vaccine does roll out and it isn't affecting people, then that will reassure them, and then they'll then want to take it as soon as possible. 16.7% of people says, no, I'm not keen at all. And 2.8% of people said, I'm not sure, or I'm not in the UK. Anyway, what do you think about all this? I, for one, am going to be glad when I don't have to go around Tesco's looking like a bank robber or a dentist. Anyway, you can let me know down in the comments. If you want to see more videos like this, you can let me know by giving the video a like, subscribe to stay updated, and I'll see you in the next one.